Drugs used in obstetrics have a huge impact on the outcome of both mother and the baby. Drugs used during first trimester can produce congenital malformations, and the period of greatest risk is from the 3rd to 11 weeks of pregnancy. During second and third trimester, drugs can affect the growth and functional development of the fetus, or they can have toxic effect on fetal tissues. There are different drugs used during pregnancy, labor, and postpartum. Here are the drugs used in labor: oxytocics, anticonvulsants, analgesics, and anticoagulants. There is a separate video on the topic oxytocics, and the link for the video is found on the upper right corner of the screen and on the description. Please don't forget to watch it. The next line of drug are the magnesium sulfate, which comes under the topic anticonvulsants. The preparation is available as an injection in one ampule which contains 2 ml magnesium sulfate. As a tablet, it is available in 64 milligrams. The action of magnesium sulfate being decrease the acetylcholine in motor nerve terminals, which is responsible for anticonvulsant properties, thereby reduces neuromuscular irritability. It also decreases intracranial edema and helps in diuresis. Its peripheral vasodilation effect improves the uterine blood supply, has depressant action on the uterine muscles and the central nervous system. The indications: it is valuable drug lowering seizure threshold in women with pregnancy induced hypertension. Used in preterm labor to decrease the uterine activity. The contraindications are heart block, impaired renal function, pregnant women, actively progressing labor. The adverse effects being in the side of maternal, severe CNS depression, evidence of muscular paresis. In the case of fetal, tachycardia, hypoglycemia. Dosage and route of administration. For control of seizures, 20 ml of 20% solution IV slowly in 3 to 4 minutes, to be followed immediately by 10 ml of 50% solution intramuscular and continued 4-hourly till 24 hours postpartum. Repeat injections are given only if knee jerks are present, urine output exceeds 100 ml in 4 hours, and the respirations are more than 10 per minute. The therapeutic level of serum magnesium is 4 to 7 milliequivalent per liter. 4 gram IV slowly over 10 minutes, followed by 2 gram per hour and then 1 gram per hour in drip of 5% dextrose for tocolytic effect. The nurse has to consider to assess the patient's vital signs 15 minutes after IV dose do not exceed 150 mg per minute. Monitor magnesium level if using during labor, time of contractions, determine the intensity. Urine output should remain 30 ml per hour or more. If less, notify the physician. Examine the patient reflexes, knee jerk, patellar reflex. Administer only after calcium gluconate is available for treating magnesium toxicity. Using infusion pump, monitor carefully IV at least than 150 mg per minute, circulatory collapse may occur. Provide seizure precautions. Place the client in single room with decreased stimuli, padded side rails. Positioning of client in left lateral recommend position to decrease the hypotension and increase renal blood flow. Evaluate the patient mental status, sensorium, memory, respiratory status, and the reflexes. Discontinue infusion if respirations are below 12 per minute, reflexes severely hypotonic, urine output below 30 ml per hour, or in the event of mental confusion, lethargy, or fetal distress. Analgesics: valethamate bromide injection, epidocin. Cervical spasmolytic, and the preparation comes as an injection in one ampule which is equal to 8 mg per ml. The action of epidocin is that it is both central and peripheral anti-muscarinic agent. which is a competitive inhibitor of acetylcholine at the muscarinic receptor. Indications: cervical dilatation in the first stage of labor, symptomatic relief of GI tract and ureteric colic. The contraindications of this medication includes paralytic ileus, myasthenia gravis, hypertension, ulcerative colitis, closed-angle glaucoma, CVS disorders. The adverse effects are dryness of mouth, thirst, dilatation of pupil, palpitations, giddiness. Dosage and routes of administration. As an injection, 8 mg deep IM is advisable. It may be repeated after 4 hours if necessary. The nurse has to consider and advise the patient to report for any blurred vision, giddiness, dry mouth immediately. Advise the patient to get up from the bed carefully. Tramadol hydrochloride. The preparation is available as an injection and tablet. As an injection, 1 ampule is equal to 50 milligrams and the tablet is available in 3 different dosages of 50 milligrams, 100 milligrams and 200 milligrams. The action is that it is used to bind the opioid receptors and inhibit the reuptake of norepinephrine and serotonin. Indications: moderate to moderately severe pain, safe given during labor as it does not cause depression to fetal respiratory center and hence safe for the baby. Contraindications: breastfeeding mothers, hypersensitivity, hepatic impairment, increased ICP. Adverse effects: dizziness, headache, malaise, hypotonia, nausea or vomiting. Dosage and routes of administration: 50 to 100 milligrams IM 6 hourly or as required. Nurse has to consider to monitor the patient's CV and respiratory status. Monitor patient at risk for seizures. Monitor patient bowel and bladder. Coagulant, vitamin K. At birth, the newborn does not have bacteria in the colon that necessary for synthesizing fat-soluble vitamin K. Therefore, newborns have decreased level of prothrombin during the first 5 to 8 days of life. The preparation is available as an injection. 2 ml vial consists of 2 mg per ml. Action: it promotes the hepatic formation of the clotting factors 2, 7, 9 and 10. Indications: it is used to treat and prevent certain bleeding problems. It helps the liver to produce blood clotting factors. The contraindications being hypersensitivity, and the adverse effects are pain, edema may occur at injection site. Allergic reactions such as rashes and urticarial may occur. Hyperbilirubinemia. Dosage and route of administration: 0.5 mg IM within 1 hour of birth. Nurse has to consider to document the giving of the medication to newborn to prevent an accidental doubling. Observe for bleeding, usually occurs on the second and third day. Observe for jaundice. Observe for local inflammation. These are the points to be noted very carefully. No drug should be administered to a woman during pregnancy, labor, and birth unless a woman is fully informed of the known risks and the relevant areas of uncertainty regarding the effects of the drug on the physiologic and neurologic development of the woman or her baby. The drugs that are used daily in obstetrics can have a huge impact on the outcome of both mother and the child. Therefore, obstetric providers need to have a very clear understanding of the mechanism of action, doses, and side effects of the most commonly used drugs. Thanks for watching. If the contents of this video are informative, like the video, share this with your friends and colleagues. Please don't forget to subscribe the channel and click on the bell icon for more updates.